So hi everybody, we're super happy today to be able to do kind of a virtual house with our Halifax team. So I'm excited to introduce a couple of people here. Myself, I'm Dana, and I'm the marketing manager for Carecor. And I'm here in Toronto today. We have Rachel, the Director of Client Services, the branch director for Halifax. We also have with us Jake, and he's the recruiter for Halifax. And we have Jay, who's the staffing coordinator for Halifax. So good morning, everybody.
Good morning.
Good morning.
Good morning.
So we did this video today to kind of like let everybody know who we are, what we do, and opportunities that are available to everybody out there who are interested in working in healthcare. So a little bit about Carecor. We're a healthcare staffing agency that's been in operation now for about over 35 years. We have offices in London, Hamilton, Ottawa, Toronto, and of course Halifax, who we're speaking with today. So for anybody who's ever wanted, like I say, to work in a hospital setting, this is a great opportunity to know a little bit more about how different that might be than working in the community or even traditionally long-term care. So what I first wanted to do today is kind of ask some questions to the team. So my first question is, to Rachel, what jobs do you offer in your office?
Okay, good question. So we offer employment for all kinds of different positions, from hands-on positions, nursing, typical registered nurses, LPNs, licensed practical nurses, PSWs or CCAs as they're known here in this province. And we also have opportunities for unique support clerical roles, such as unit aides, unit clerks, and even patient attendants who provide one-on-one support with our patients in a hospital setting. Some of the different areas where our staff can work can include places like we do a lot of medical surgical staffing. We do some staffing in mental health, rehabilitation areas, emergency room staffing, and we've recently moved into a little bit of long-term care nursing as well to sort of help out during the COVID pandemic. We've stepped up and we're able to help some long-term care facilities in our community, which has been really rewarding, both for us here in the office and for our staff. So that's a nice little area that we've expanded to.
That's awesome. And I do know that we have the travel nursing program for Halifax. And so for a lot of nurses, new nursing grads coming out of school here in Ontario that don't have the required hours to be able to go right into an acute care setting and work in hospitals, we have that opportunity available where new grads are accepted in Halifax. So you want to talk a little bit about that, Rachel, as well?
Sure, yeah. So we've got a really unique opportunity here where we're able to offer nurses who are relatively new to the job, so recent graduate, somebody with very limited work experience. We are able to place them in a hospital setting and provide them with supported orientation shifts and help them with a learning plan and really hold their hand as they transition from graduate nursing to a fully independent practitioner. So during your year of stay that you'll be here with us in Halifax, we'll move you from sort of some easier units into more difficult, more challenging nursing situations, which will really help you build your skills and get a good handle on med surgical care. So even if all you've done is a clinical placement med surgical care, you've got the basics to get started with us.
Great.
So
it's great for a new grad, hey, because I know that this placement is for 1 year to go down to Halifax, and any participants welcome to, I think, join the Halifax team if they want to once the contract is done. But we're really looking at helping out, a lot of, like I say, nursing new grads that once they return to Ontario, then they're all set, ready to go with their number of hours and experience, and they can be hired here at one of our Ontario teams, which is great. So yeah, so thanks for that, Rachel, for giving us some kind of updates on what roles we currently hire for. I think it's really important when you talk about the roles that, yeah, it sounds great, but how do you get hired? So I'd like to turn that to Jake to talk a little bit about, you know, how when facilities sometimes they have different credentialing and immunizations in the acute care setting that perhaps weren't required in home care or LTC, and just kind of want to giving a heads up to people about what to look for when they apply.
Sure, yeah. I mean, I've definitely noticed it seems when people are coming from a long-term care facility, the immunizations and just the required documentation might not be quite as strict as it is for the hospital. And we do follow our clients' guidelines. That's measles, mumps, rubella, varicella, tetanus, diphtheria, pertussis, a TB skin test within the past year, or a negative chest X-ray within the past 5 years. You need to have your CPR up to date. And again, I think that might not be a requirement for every long-term care facility, but it certainly is for the hospitals.
Right. So that'd be something that perhaps wasn't required in community care, and just want to make people aware of, you know, when they're applying, that they have all this information. Also, too, in terms of the hours that are available in different in varied settings, do you want to talk a little bit about that?
Yeah, so I mean, we do cover, for the most part, med-surg floors. And for CCAs, it's considered a care team assistant. You still require a CCA certificate, but there's quite a few differences and also quite a few similarities. You would be expected to do the normal things, such as activities of daily living, hygiene, nutrition, rest, and mobilization, but there are some expectations not necessarily that are common in a home care or for long-term care. That could be checking vitals, documenting vital signs in patients' charts, using glucometers. I think CCAs are normally taught these things during their program and ideally exposed to them during their clinicals, but they don't really do that in most long-term care facilities. And if you are considering transitioning into acute care, it certainly is important that you'd be comfortable with these expectations or learning these expectations. For nurses, I think the differences between home care and acute care are a little bit more well known. You would certainly be responsible for much higher acuity patients, and for the most part, we do, like I said, cover med-surg floors in the adult hospitals here in Halifax, and you'd probably be expecting a 5-patient load on average.
Okay, and the hours would they're around 8 to 12-hour long shifts in one facility, correct?
Yeah, so I mean, I think that's pretty common for long-term care facilities as well. But yes, I guess home care, it's more or less 4 hours at one host and then on to another.
Yeah, great, thanks. So what's the recruitment process like? So I've got my resume, I've sent it on in to you guys. What can I expect as a candidate? Wondering what's going to happen next.
Sure. So normally we would have a pre-screening interview over the phone, and that's just to go over the candidate's resume and their past experience, as well to give them a little bit more information about Carecor and our expectations. This only takes 10 to 15 minutes normally. And if that goes well, we move on to an in-person interview, or more recently, we're doing Skype interviews. And this can take anywhere between 30 minutes to an hour, depending on their designation and any overall questions I may have during our conversation. And once an offer is accepted, the time it takes to begin work varies quite a bit. We have had people who were hired on a Friday come in for orientation on a Monday, but normally that's not the case. There is, as we spoke of earlier, quite a bit of required documentation to work in the hospitals. So if you are already working in healthcare and you have your immunization records, a recent TB test, your CPR is all up to date, you could be ready to go in a week or two.
That's fantastic. That's great. So thanks so much, Jake, for all those updates. Now I'm going to turn it to Jay. Jay's one of our many staffing coordinators in the Halifax office, and I think it's important to highlight. We can all agree it's important to highlight what can you expect once you're hired on our team. Your day to day, speaking to the staffing coordinators and wanting to know what kind of shifts can you get, what that relationship looks like. So I want you to take it away, Jay. Tell us about what
Right.
happened.
So, yeah, thanks for the question there, Dana. So basically, as a staffing coordinator, we're your eyes and ears. So in terms of like shifts that you're interested in, so we are able to find shifts that accommodate your availability and sort of like give you the shifts that you want and make you satisfy and what units you can go to and stuff. So we are the eyes that you can use, so we know where the shifts are, and if you have the availability updated, we can also use that and make sure that we follow your available dates, and yeah, just make sure that we have the right shifts for you and you're happy, and we treat everyone here like family. So it's pretty much a close close family here. So yeah.
Yeah. So talk a little bit about how you can be reached. I think there's a couple of different ways, the phone,
Yeah.
text, that kind of stuff. So I want to talk a little bit about that.
So for a phone call, we're actually available 16 hours a day. So there's like a main line that staff can call in. And like I said, we're the first one that you hear. So we're the voice that you hear early morning, asking you to be like, hey, good morning. We have a shift here. So we're always so happy and excited. So, like you will feel the same way, and that like to get you going for the day. And yeah, so that's 16 hours today. We're approachable. Like if you call the main line, and also via text. So we send text out for like available shifts, like all throughout the province actually. So you'll be letting know like if there's a shift availability for certain hospitals or facility. So you'll be the first one to know. So we send those out as well, and as well as emails. So we have generated emails sent out as well with details of all the shifts and dates, and yeah, all the things you need to know for taking the shift.
So it sounds like, not only is it staffing coordinators, you can pick up the phone and talk to you guys, but by having text messaging and that kind of thing as well, and emails, it allows that, you're busy. Maybe you can't pick up the phone, as that technology is there as well, which is great.
Yeah, it is.
Yeah, so thanks so much, Jay.
Thank you.
The last question I do have is, of course, I'm directing it towards Rachel, because I think when you're working and you're in a remote environment, meaning remote, you work for us, you work for Carecor, but when you're in the hospital, that's the work environment. So you think you're working for the hospital, but you're working through Carecor. So if there's ever a concern while you're on shift, or you need that extra support, Rachel, can you talk a little bit about what that looks like for employees?
Yeah, definitely. Good question. Of course, support is always, a really important part of your work. And one of the things that we like to really brag about is that we do it really well within Carecor. So kind of what Jay was talking about, we are available 7 days a week from 5 a.m. to 9 p.m. every single day via phone, text, email, etc. And there's even an emergency on-call for after hours. So 9 p.m. to 5 a.m. we have an emergency on-call, a nurse available, so you are never alone. The types of support you'll see will start at every single level. So first off, you'll meet Jake, who will provide you with support to get your credentials completed and to help you through the application process. Then you will get support from our scheduling supervisor to help make sure that your schedule will work for you. So our wonderful scheduling team and our supervisor work really hard to get you the shifts that you want. In addition, we have nurses on staff that provide supervision and education ongoing for field staff. And we also have things like meetings and in-services and field staff meetings, lately, of course, via Skype, but sometimes in the office here too. So, and we'll have staff parties and other, fun levels of support, like community team building. We'll have activities. So there is always the warm circle of support from the Halifax office here, both on a professional level and a personal level, to help you really feel fulfilled and give you the warms and fuzzies about your work.
That's great.
Yeah.
So this is wonderful. I mean, we've gotten to touch on everything here today, from a company itself to in Halifax. Yourself, Rachel, is the branch director, looking at how are we going to hire people, Jake, and Jay, what that looks like to once you're part of the team, what you can expect. So thank you so much to everybody for joining me on the call this morning, so we could let the public see you a little, do kind of a virtual open house. For any of you out there that would like to become part of the Carecor team, we specialize in acute care staffing and of course a little bit of LTC right now during the COVID-19 response, which we're very proud to be able to step up and do and to distribute some of our staff there, and of course still continue to hire for that as well. So if you want to join our team, please follow us on Facebook, check out our opportunities, and we look forward to getting your applications. So yeah, again, thanks guys. I hope you all have a great morning.
Thank you.
Thanks,
Nice to chat, Dana.
Bye for now.
Great. Thanks.
Have a good day.
Bye. Yay.